third panel discussion is themed at innovative technologies reshaping health infrastructure. Infrastructure is something that is the backbone when we talk about providing these services to the citizen, and it has to be seamless, it has to be very strong that any country can sustain even any kind of pandemics which are there, and Dubai, UAE has been one such nation which has coped up very well with this world-class infrastructure. The aim of this session is to explore potential benefits and challenges of technology, which is hindering a perfect healthcare infrastructure. We also want to discuss some best practices which are being adopted by various of our speakers, various of our experts who are going to join this panel, and how we can provide a good health system in a way that it provides patient outcome and support the overall health infrastructure. So with this, I would like to invite our speakers for this panelist for this session, and moving with the very first speaker, our moderator. I would like to welcome Mr. Ranjith Verghese, the Senior Director of Business Transformation and Change Management, IQVIA. Sir, can you please have you on the stage? Next, I would like to welcome Mr. Himanshu Puri, the Head of Information Technology, CIO of King's College Hospital, London, Dubai. Thank you so much, sir, for coming. Mr. Padam, Kafle, the Head of Information Technology and Automation from Aster Hospitals, UAE. Thank you so much, sir, for coming here. Mr. Jaleel, Rahiman, the Director of IT and Prime Digital from Prime Healthcare Group, LLP. And last not the least, Mr. Aliasgar, Bohari, the Senior Director of Information Technology from Zulekha Hospital. And I would request all the audience to keep this conversation, two-way. We have had a fantastic support from all of you guys. It's just that if we have some more questions towards the end, it will make the panel discussions more interesting. So over to Mr. Ranjith Verghese. We have exactly 45 minutes to end this panel. Thank you so much.
Thank you. Good afternoon, everyone. I know it's a difficult session, usually post-lunch, but the good thing is that it's
Ranjith,
a shorter one.
Just I would like to interrupt. We have one more panelist joining this session at the last minute, Dr. Sayf, Abdelrahman, the Chief Executive Officer of Topmed, Health Catalyst Exclusive Service Partner, MENA region. Sir, can we please have you on stage?
So, yeah, Mr. Sayf, I think you're all set. Dr. Sayf, yeah, all set. And then fine, thank you for the last minute entry onto the podium. Again, good afternoon, everyone. As I was saying, it's going to be a shorter one given its post-lunch session, but we'll try and keep it as interactive as possible, engaging as possible with our esteemed panelists here today. Before we start off, I think a quick round of introduction. Maybe I can start off from my end. Ranjith Verghese. I am the Senior Director for Business Transformation and Change Management for IQVIA for the AMESA region, that's Africa, Middle East, and South Asia. I've been in the region for about 2+ decades, and IQVIA, as some of you or most of you would know, we are into the core healthcare space, driving digital transformation at a national level in the region here. And with that, transformation and change is a core essential part of it all. Again, very privileged and honored to be here moderating this session. Maybe we'll go with, yeah.
No, thank you for having me on this stage. We had some great sessions in the morning. Thank you for sharing your knowledge. I've been with King's College for about 2 years now, but in the healthcare industry for about 2 decades. Have got experience in this part of the world, in the US, spent a couple of years in Australia, a couple of years in Sweden, and now I'm carrying the British legacy into this part of the world. King's is doing everything to bring the class that NHS has established in the space of healthcare and trying to do or mimic the clinical guidelines in this part of the world while catering to the local regulations and for the best of the population. So I'm excited to be part of this panel. Looking forward for the discussion.
Thank you, Himanshu. Yeah.
Hi, good afternoon. My name is Padam. I am actually taking care of IT and automation for Aster Hospitals, UAE and Oman. So by profession, I am software engineer, so I used to write a lot of codes. So especially I write the code for this healthcare softwares. So now my job is to automate the process in the hospitals and take the IT operation with the latest technologies.
Thank you for them.
I believe now you can hear me better. All right, my name is Jaleel. I'm the IT director for Prime Healthcare Group, and also look after the digital part of Prime. I've been in the industry like others more than 2.5 decades. Worked across payers, pharmaceutical and healthcare with Prime for 8 years now. So I think with that, I'll pass on the mic and let's start.
Thank you, Jaleel.
Good afternoon all. Myself, Aliasgar Bohari, I'm the Senior Director IT for Zulekha Healthcare Group. And as usual, I also have 2 decades of experience in healthcare, working with Zulekha from almost more than 20 years. Thank you.
Thank you. My name is Dr. Sayf Abdelrahman. I'm CEO of Topmed. Topmed is an exclusive partner to Health Catalyst, which is famous American company in healthcare analytics space. We provide professional services in terms of outsourcing and supplying direct analytics services to healthcare providers and supporting the healthcare solutions providers, IT departments in hospitals and consultancy firms in order to improve the linkage to the data and refining the data and connecting the data and enable the softwares as well. So our business depends on a new model or innovative model, we could say. We are merging both analytics functions with subject matter experts. That's how we help everyone. Thank you very much.
Thank you everyone. Thank you for that intro. Maybe before we get into the set of questions, I thought it would be a good idea to look at some of the macro level trends, when it comes to big tech. The previous panel discussion was more focused from a business, commercial, business, operational perspective. Here with all the tech gurus here, I think the more building on that is going to be looking at what are those innovative technologies, right? And what are the key trends that we are looking at? How do we bring it to life here in the region? What are the challenges? What are the opportunities here? And how does that look in the overall horizon over the coming next few years, right? Just to set the context, I was just looking at some of the latest reports on big tech in particular. And the likes of the big tech companies like the Amazons, the Apple, Microsofts, and so on and so forth. If you just to throw some high-level insights on what are the trends happening and then build on that. So Amazon, for instance, is looking at real AI/ML areas, going specifically into life science in particular. And we see there is a shift. Again, we heard from the previous panel where primary care is much, much more of a focus. And how Amazon is driving with their acquisition recently on One Medical, for instance, right? And then the whole Amazon clinic concept that they're looking at beyond just their employees, and then how they can extend this whole experience to the health consumer base, right? So that's a key trend. And then to envisage a scenario of how, disruption in the primary care can happen, thinking about how Amazon Clinic plus Amazon Prime, for instance, how that's going to evolve and expand over the other geos is something to really watch out for. And I think when it goes into areas like Halo and Alexa and so on and so forth, right? There was a touch base about providing hybrid experience, right, to the members and healthcare consumers here. So that whole phygital experience, as we call it, is something that we clearly see how the Amazons are getting into that particular space. The other thing that we are seeing is on precision medicine. For instance, Amazon has gone into launching cancer research. From Onco perspective, I think they've really partnered with Fred Hutchinson, and then they are looking at really personalized care hyper-personalized care when it comes to onco and vaccinations in that particular space. If you then move to the Apples, they're very much laser-sharp focused on the gadgets, on their watches and iPads and so on, more in the healthcare settings, and the care at home per se is what we are seeing within what Apple is looking at. More in the B2C segment is what these two large tech are looking at. But then when we move into Microsoft, we see that they're more and more into the B2B space, wanting to really create a overall healthcare ecosystem for the organizations that are servicing or funding the whole healthcare value chain per se, right? Some other trends that we are seeing with Microsoft, for instance, is the HoloLens 2, for instance. They're experimenting in AR, VR, for instance, especially in challenges of surgical training. That's an interesting area. Again, from health infrastructure and enablement, clinical workforce enablement, that's the trend that we are looking at. And of course, Microsoft, we see that, the overall acquisition when it comes to Nuance, the voice tools and the latest in ChatGPT, we need to see how they venture beyond the B2B space as such. If you move to Google, for instance, we see again they are more focused in the life science space and precision medicine space. The clinical search engines that they are really looking at more in terms of Care Studio, that's another key area that Google is venturing into. And some of the other interesting aspects is about home care, smart homes, and nests that they are really looking at to penetrate in that particular space as well. And then lastly, the Oracles, I think we're all aware about where Oracle has gone into with the Cerner acquisition, and again in a B2B space, how that's going to unfold is really what to watch out in the overall big tech space, right? That's just the context setting, the macro scenario that we see. And if we now move into our region here, and then to begin with, maybe I'll start with you, Himanshu. What do you see? I mean, hearing some of these global trends, innovations that are happening in the tech space, how do you see this evolving on the ground, grassroots levels here in the region, right? And particularly with a focus on patient outcome, cost effectiveness per se, and increased efficiency, right? It would be good to hear your thoughts.
Right, thank you, Ranjith. I think that's a perfect question to start our discussion. We are in a phase, especially in this part of the world, where we're moving away from just taking care of patients who come for simple things like fever, cough, and the demographics of patients have changed. The demand from patients are changing. We are bringing in patients into their own care system. These are some things which were not part of discussions a few years ago, right? Let's say a decade ago. Families are getting more and more involved, right? So when you speak about patient outcome, while you take care of them clinically, you bring in the technology to manage the care of the patient. I think there is scope in looking beyond treating the patient, right? So to your point on how the outcomes of patients are influenced, is not just limited to clinical care. 10 years ago, again, or 15 years ago, most of the patients from this part of the world used to travel out for tourism, medical tourism. Now there is an influx of patients that is coming for medical tourism, right? And most of that is also creating additional awareness in the population, in the governments, and in the provider segments. So, technology is probably the most influential factor when it is catering to all these changes in demand. Data, I'm sure we will speak a little bit more, but I think data is creating that foundation above which we are building a lot of our technology on. Now, if you look at telehealth is not a new concept. I remember reading somewhere. Yeah, there was something called Dr. Radio. I don't know if you're aware, in the mid-30s. Right? That is how consultation actually started. And it's only recently that we're talking about telemedicine. Right? Remote patient monitoring, you briefly touched a bit about it. A lot of devices, IOMTs, a lot of new devices are building on top of telemedicine and moving into the remote patient monitoring space. Nevertheless, there are challenges because at some times you have difficult populations to take care of. You have more complicated diseases that people are getting into at much younger ages. So healthcare is ever evolving. Technology is evolving faster than healthcare. Now, how do we bring all of this together to bring the outcomes that we need is a tricky situation.
Right.
But I'm sure everyone in this room are fighting that race every day.
Right, yeah. No, thanks. Maybe just to add on to that, maybe from, from Padam's, your perspective, especially from being in the automation space as well, right? Just building on what Himanshu just mentioned, it will be interesting to see from an automation perspective on optimization, operational optimization, efficiencies as well, ground realities, how do you tackle that, especially in your organization, would be interesting to hear on top of what
Right.
Himanshu also just...
So we'll start by Himanshu. So basically, our CEO always used to tell, right? So the care what we are doing is not a health care, it's a sick care today, right?
Yep.
When you are fall sick, then you are going to hospital.
It's very reactive in nature.
Right. But the demand today is not the sick care, but the health care, right? So the technology, obviously we are doing a lot of trial and we are doing a lot of testing into the hospitals, the different hospitals. So our aim is to give the pure health care, right? So if you are potentially fall into the sick, why do you need to go to the hospital? Why don't you to be connected by someone, right? So the remote care. So today, a lot of gadgets are available. You have wearables, right? So obviously, the best example is the Apple Watch, right? But beyond that, the Apple Watch is just like your cardiac care. It is proven, but there are a lot of other gadgets which can even give your skin temperature. It can give your, the blood pressure measurement, right? So the technology to connect all this data to the care provider, and then whenever there is potential, the person is potentially to be sick, right? That they should be care by remote, or obviously there is a concept of the home care, so the people can be dispatched to the home if the remote care is not possible, right? So this is where we are looking for, and I think that is something going to be a true healthcare.
Right. Yeah, thank you. Yeah, thanks, Padam. Yeah. We had an interesting lunch conversation with Jaleel, and maybe I think that could be something to build on, especially on some amazing stuff you're doing on personalized care, and then again from a patient outcome perspective. Yeah. Over to you, Jaleel.
Yeah.
It would be good to hear you.
I think it's nice to hear different technologies, and you mentioned about different, the big names spending in different areas, and Himanshu also alluded to a few of them. My take on this is actually you need to look at what is the value for your organization and what's the value for the patient, right? And we should not go too much driven by technology, but go by the value that technology or the problem that is laying in front of you. So what we've looked at some of the things in terms of, as we just heard, there are situations where patient need not come, or there are situations, chronic patients, they're taking their vitals or they're taking their measurements, could be a blood sugar, on a regular basis. Now we looked at, if we get that data, how can we help them back on a real time than waiting for the next visit of the patient, right? And that's how we introduced a product called Falaktai, where we are actually monitoring the patient's vitals at home, and we're getting alerts if something goes wrong, and then we get back to the patient to take those corrective actions and not really wait for the next visit of the patient, right? Now, that might sound quite simple, but to get that implemented we are talking technology here, so there are different technology pieces that come into it. There's big data, there's IoT devices, there are alert systems, there's quite a lot of those, right? So the whole thing is, as I mentioned, what is the value to the organization, what is the value to the patient, and how do you stitch all these technologies together and to make sure that the data is not in silos and you have an end-to-end process. I think that's very key. And I think that's what we all need to work on. So that's been our approach to things. And like you rightly said, there's a lot of technology, and technology has been already there. It's there for a long time. And some of them are new. Yes, it is new, but then, how are you going to adopt it? What problem is it going to solve for you and for the patient? I think that's very key.
It's key. Yeah. Absolutely. I mean, that's a valuable point that you mentioned there, Jaleel. Yeah. Ali, your take on...
Actually, he has already answered the same thing. But what he said is absolutely right, that it's all depends on your, you are going to give service to the patient. So what exactly your patron needs, you must know that. And according to that, you should install whatever technology is available. There are a lot of big names are there, and there are things we can do it, but everything we cannot do it. So what exactly your need and how you are going to do it. Like for Zulekha Hospital, we have seen in times of COVID that how data is very important. And that's how we have started more using on business intelligence tools where our decisions are data driven. Data is actual gold mine. All we are here since 1964. So we have a huge kind of data, but again, as he rightly mentioned, it should not be in silos. So that full process and the full data, uses of that data for your patient care. So you have clinical data, you have appointments data, you have no-show data, you have anything and everything, you have it. Now how you have to use it through technology, and which is going to beneficial to your patrons in terms of full clinical care is very important. So
Thank you, Ali. Yeah. I think Dr. Sayf, especially from a data point of view, I think that's a key pivoting point.
Thank you very much for the input of my colleagues, and I think I'm going to have the subject from different point of view, because basically and originally I'm a doctor, okay? So, and I know my colleagues have very strong background in IT. So I'm trying to mix all together here. Yep. So the new technologies really having both aspects, opportunities and challenges is what I see from point of view. Yep. Okay, and there is a great burden on the shoulder of the CIOs in that big groups that's staying beside me here, because everyone is pointing the finger to the CIO while selecting, while implementing, while getting results and achievement or frustrations. It goes back to the IT department, which is really unfair. So what goes with the new technologies, it's actually a process, okay, undergoing a process. I give one example, and I believe our future in healthcare is going to be affected a lot by the 5G technologies. As an example, one consultant in America can lively make an operation to a patient in the Middle East in real time using robotic surgery procedures, okay, in real time, and doing the operation by himself, controlling the robots, right? And it happens.